Wants to go by there and watch them.
Call the order of the Stokes County Commissioners on Monday, October the 27th. Let's stand and Sonia will have our prayer.
Heavenly Father, as we come to you today, we'd like to thank you for all your many blessings. We'd like to thank you for allowing us to be here today to do the business for the county. We ask that you lead, guide, and direct us in all that we say and do. It's your name that we ask these things. Amen.
Amen.
Pledge
Allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do we have any public comments?
We have to approve the agenda.
Yes, I do. Need approval of the agenda.
Motion approved.
Do I hear a second?
Second.
All in favor? Now, do we have any public comments?
We do not.
Do not? Okay, Brad, you can open the comments for the commissioner.
So welcome everybody today here in person. Of course, so far just nothing but employees. But streaming and on YouTube and everything. Real quickly, just want to highlight and remind some people of some of the Crime Stoppers program here in Stokes County. I had the privilege to go to a meeting last Tuesday night of the board. It's been in operation since February of 1984. Right around COVID, they kind of didn't do a lot of meetings, obviously. So they're trying to get it back on board. But I just want to, I worked a lot with the Crime Stoppers in Fayetteville, Cumberland County. It's a great program, and I would like to remind people that if you're interested in making sure your community's safe and helping law enforcement here in Stokes County, that you can donate money to help pay for the awards that are issued out. And the other thing that you can do is call in anonymous tips. It's a standalone organization. It's a public-private partnership type situation, Crime Stoppers, but it's a 501c nonprofit. So if you're a business and you want to contribute and help out in any way, I'm sure that the Crime Stoppers board would be real appreciative of it. And I think that it's another way to help the community with the crime problems. That's all I have, Mr. Chair.
Rick, you feel like talking?
I'll just welcome everybody and that'll be it.
Wayne?
Great to see all the employees here. Everybody watching the live stream. Been a busy day. Great for our county. They're making the film here in our county, using a big area of our county, and I just ask that the citizens please be patient. Some of the roads we've been shut down. Is on Carroll Road today. We had it shut down. It's still shut down. So I ask everybody just be patient on that, and I can't wait till they put it all together.
Yep, I'll just welcome everybody that's watching online and you employees in the audience today, since that's all we have. But thank you for coming out. We look forward to your things that are on the agenda, and that's all I've got.
Jeff?
I too would just like to echo, it's great to see everybody here today.
Welcome back, Amber.
Thank you. It's good to be back. I don't have any comments besides
Okay.
that. I'm glad to be back.
I'd like to welcome everybody that's here and who's watching also, and to add to Brad's comments on I forgot what
Crime Stoppers.
Crime Stoppers. Well, let's add community watch. Does it even exist anymore?
Well, they do have a community watch program, but I think it kind of comes and goes. It's just if there's crimes in certain neighborhoods and people get involved, and then when the crime goes away, then they go away.
And I'll give you an example. A year ago, Our neighbor at the end of the road, we live on a dead-end road, but there's several mailboxes there. And he noticed somebody just studying the packages that were left there. Well, they left, but they come back, and he noticed it again, so he wrote down, this time he took the packages, and he got his license number, and they called him, and they've been chasing this guy for 2 years. So it does work, just that simple. I'd like to thank all the mayors and the city council members who come last Thursday here. I thank Olivia for help putting it together. We had a good meeting, good meal. And with that, that's all I got. Conflicts of interest. Before we move any further, does any board member have a conflict with any of the items on the agenda for today, or one that might be perceived as a conflict of interest?
No.
Consent agenda. Have a motion to approve.
Motion approved, consent agenda.
Second.
All in favor?
Aye.
Information agenda, register of the deeds, quarterly report.
Afternoon.
Hey, Brian.
Well, thanks for getting me on the agenda today. It was a new process. We went through all that training a few weeks ago, putting everything together, but it was pretty simple. The handout went well with the flow of the website, and Olivia helped me out with the link and everything, so thank you for that. I've got numbers from the first fiscal quarter of our current fiscal year, third quarter, if we're looking at the the calendar year. Our total recording fees were $66,899.75. Our excise tax collections was $148,987. Total revenue for the quarter was $215,866.75. You can see the number of documents we recorded, the different types and so forth on your report. The conveyance tax, which is half that excise tax that we sent to the state by statute, $74,493.50. The Domestic Violence Center, Children's Trust Fund, all those right there in that box on your report. That's all the money we sent to the state for the year or for the quarter. $85,608.10, leaving us with a net revenue for the quarter of $130,258.65. And I want to make a note on that. Commissioner Chandler asked me last time I was here about those funds for the state, specifically the Domestic Violence Center and the Children's Trust Fund. And the Domestic Violence Center, I did get some concrete information on, and that does come back to the county because that's one of 4 funds that the Domestic Violence Center pulls from the state is that marriage license fund. They kept saying ML while I was on the phone with those folks, ML fund. And I'm like, what's he measuring in milliliters? And it was the marriage license fund. That's what he called it. So anyway, yeah, that does come back to the county through that office and in connection with the PTRC. The Children's Trust Fund, that does fund programs in schools, and a lot of school systems receive funding directly from that program. I don't know if we have any directly here. The Stokes Partnership for Children would probably be a good resource. And I haven't reached out to Cindy about that yet, but yes, the money does come back. Okay. So the revenue, it was 8% down over the last quarter, but last quarter was very, very busy. So I'd say we're pretty close to holding steady on our numbers. I think by our sales and so forth, I think we're probably seeing a peak in home and land prices around here. They're not as high as they were a year ago. I think it's still not what we saw years ago as far as normal, but it's not like it used to be quite as bad, which is good for the consumer. One statistic I will make mention of as far as the office goes is the marriage license issuances. It's definitely that season at the office. We've got a lot of venues here, and outdoor venues are the way to go that's the go-to for couples nowadays, and we've got a lot of folks coming here to be married, and we got a lot of venues. Of course, pretty scenery. You don't see it as well today with the clouds, but it's there, and people are really taking notice of it and coming here to get married from all over. I've had folks from Oklahoma, Kansas, Texas, Tennessee just in the last 2 weeks. usually they have a connection. Maybe their spouse is someone from this area, but I remember we had a couple, I don't know, maybe a year ago that he was going to be stationed in Wilmington, Coast Guard, and his wife was from Chicago, he was from Florida, and they wanted to get married in North Carolina in Big Tier because they saw Hanging Rock and liked it. So you just never know. We get people from everywhere around here now for marriages. It's good for tourism, good for the economy, and so forth. As of this past Wednesday, that's the last time I looked at the marriage license issuances. We've issued 64 since Labor Day, which is about when this season kind of picks up. And we're issuing about 2 licenses per day, which is it's kind of more than double what we do normally average. And transitioning into updates from around the office and flowing with marriage, we implemented a online marriage application back in March 1st, where couples can submit applications to be married online through that portal on our website now. A lot of couples are using that. We'll see 15 to 20 in that queue at a time that show up in there. And that's been in operation now a little over 6 months, and people really like it. It does cut the time there in the office in half. As long as they have all their other documentation. By statute, they still have to appear in person. It's still in a statute that way, but they can get most of that stuff done online. There isn't a method. I wanted to track, see how many, to give you concrete numbers, to see how well that's going, to see if how many there were that use that system now. And we don't have a process or a method to track that, but I'm going to see if my vendor can give me a report on that. We had a genealogy workshop August the 23rd. A couple of our commissioners were there from 9 to 5 at the Arts Place. I and officers from the Rockingham Stokes Genealogical Society spoke on a variety of topics. The last 2 hours were reserved for research down in the vault in our office and at the library down here. It was pretty well attended. It was pretty close to what we've had in the past, and I'm glad to see it's not falling away. It's getting, if anything, it's getting better. I hope it was a good learning experience, and we're already looking at things for next year. I'm working with our vendor Logan Systems to implement an in-document reference link to better enable those who use our remote access site for document search to find related documents. It will hyperlink the book and page references that are listed in the document that they're currently viewing. When that previously recorded document is referenced, there will be a hyperlink there within that document itself that they're currently viewing, and by clicking on it, they can just be directed immediately to the document referenced in that one. You're going to see those in subsequent instruments, which, like a mortgage satisfaction, it's always going to reference the book and page number that the original mortgage or deed of trust was recorded in. That's one that comes to mind. There's going to be several more. But that's an in-document link to a previously recorded document, so you don't have to jot down that book and page if you want to go look at it and open it up a new window and all that. You can just click on it and go right to it. It's just a little in-document access. That's a little enhancement for folks who are doing title searches and so forth. Our conferences and so forth that we go to, I saw an ad, I'm not going to say what it was for, on TV today about a certain elected official in another county going to conferences and spending this money here and there. I learned that from another register, that little in-document link. They had it, they use the same vendor I do. I didn't know they offered that, and I asked them about it, and they're working on it. We're going to go live with that next week. So networking's a real thing. If you're there for the right reasons, it can be very valuable. And that's all I've got.
Any questions?
No, good report. Thank you.
Thanks.
Thanks, Brandon.
That brings us to our discussion agenda. Good afternoon.
Hey, Stacy, how you doing?
I'm here to talk about Medicaid transportation. With the passage of the big beautiful bill, the federal government told states that they had to come up with a way to decrease monies for Medicaid programs. One of those programs was Medicaid transportation. The directive from the state was for counties to ask their vendors if they would take a 3% cut. If not, counties were to do the 3% themselves. So that's why I'm here. I just need to know how you would like us to proceed.
So what are we looking at? I mean, so they were short like $700 and some for the month of October, I think.
That's so far. It'll be upwards of about 1,000 once the end of the month comes.
But is that, so can we count on that? That would be like every month, right around that
Would be
figure?
every month.
Yeah.
Yes.
So you're looking at maybe $7,000-8,000 a year to make up the difference, or more than that?
You could,
No,
I would say
more 12,000
10
a
to
year.
12.
12,000.
Yeah.
Yeah.
And then I'm supposing that there's, I guess the state is not stepping up or anything to cover any, to include, because when the Medicaid expansion was approved by the state government, they didn't
There's
any
a,
provisions in the,
as I understand it, there's a bill that's in the General Assembly right now. I think it's passed the House, waiting for Senate action. It's designed to address some of this shortfall. I saw some numbers earlier today, something along the lines of the perceived shortfall is on the order of 700 and something million. But in this bill that's in the General Assembly now would address about 600 million of that 700 plus million. So even if it passes, we don't know if this problem is going to be solved. So we're kind of in a pickle here because we are obligated to provide the service. So it's turning into kind of an unfunded mandate, you know.
another
Oh,
unfunded.
it is an unfunded mandate, yeah.
Right.
Well, Medicaid transportation, I will say 100% of, until now, till October 1st, 100% of that transportation cost was paid by Medicaid to the providers, directly to the provider. There was not any county dollars in that piece of it.
And Stacy's reached back out to the state reps, and they've come back with their opinion is that we're obligated to meet this shortfall if the folks that we're contracting with won't take the cut. Of course, we kind of knew that would be their opinion because they sent down the directive to begin with. I've also asked the NCACC for help on this, and they arrived at kind of the same answer, but they justified it in a different way. So I don't think it's really clear. I mean, when you look at the part of the general statutes that describes how the state's Medicaid program is to be funded, it says that there's money comes from the federal government, and the state is obligated to pay every other program cost, except that counties are obligated to pay costs associated with administrating those programs at the local level. So we're only on the hook for administrative requirements. Everything else is supposed to be, by state law, funded by the federal government and the state, but the state's not doing it. So
Yeah. Stacy, what is emergent, non-emergent definition of that?
It takes people to their regular doctor appointments. It'll take people to the pharmacy to pick up medications.
it's not an ambulance ride.
It's not ambulance ride.
Does it mean non-emergency is
Yes.
what non-emergent means?
Yes.
I just hadn't seen that term. It's a 3% cut. It doesn't sound like a big number. Any program ought to be able to take a 3% cut, you would think.
Well, Wyvetti said they cannot.
They were worried about their costs.
Well, yeah, but what I'm talking about is how does this impact, how's it going, the 3% going to impact people? Is there like one less person going to get a ride or?
No, I don't think so. That's not happening at all. Everybody's still getting the same number of rides they've been getting all along, and that will continue. And we did get a letter from Wyvetti the other day where they're going to stop transporting on Fridays completely. So that will affect some folks. But they said they would keep doing dialysis and certain patients on Fridays.
You got any funds in any other program in DSS that is under running that you could shift them over to cover the shortage?
Yes. Not because it's underrunning, it's just.
Because of good managers. That was your opportunity.
Because this would be a higher priority, you mean?
Yes.
You think? I really, when you have a cut that comes down like this, and we start filling these gaps, they're unfunded mandates is what they are. I think it sets a dangerous precedent. Next week we'll get another one. So where are we going to draw the line, I guess?
You can never back your way out of them.
Well, this isn't going to go away.
No, it's going to get worse.
It is going to get worse. I mean, they're already cutting other medical providers, up to 10%. So it's across the board for Medicaid providers.
So I don't know how we can cover all that. You said, Jeff, that we're required to cover it. Are we required to cover it at this exact dollar amount? Or just cover the
We
program?
can negotiate whatever price we want, from
Yeah.
a vendor to provide the service, but
Yeah.
or if we think we can do it ourselves cheaper, but that's not likely
Yeah.
either. So
Not going to do it any cheaper. I think they're starting to pay for the drivers, the transport, around like $10 an hour. That's nothing.
If we do this program, what are we going to do when the second one comes? Anybody have an answer?
I mean,
A thought on that?
I think the bills that we're getting we're paying like $200 an hour, but
They get
I'm sorry,
$10
Rick,
an hour.
I don't know. I'm just not inclined to do it unless I'm forced to. I mean, I guess I wouldn't have a problem if Stacy could shift some funds from another program within DSS, but just to add on to this.
I think my recommendation would be that we go ahead and make this move, but make it a temporary move, and we resolve that we're going to try to negotiate, even for the different vendor. Maybe when we're up in competition, maybe we can get a better rate in the future.
Are there any other vendors, Stacy?
Well, we have used Gentle Care in the past, and we're talking with Mountain Pride Transport right now to see about contracting with them, because we are mandated to provide the service, so we've got to have somebody to provide the service.
It still seems like to me 3% cut is not a big deal. It shouldn't be a big deal in any program. And once we start this, open the gate here, the gate's going to be open.
I think Jeff's right. We don't have a choice, temporarily at least, but to try to do something, and maybe even try to talk to our state representatives and the state about how they're supposed to be the ones paying, not us, and put more pressure back on them to fund it.
We need to tell them that it's elderly voters that need this service and they're not providing.
Right.
So so let me clarify, we are required to do this, in your opinion?
We
We're
are
required
required to do it, yeah.
We're required to fill this 3% gap. It's not like there's any option.
I mean, we're required to provide the service, and like I said, we're in a pickle right now because the state isn't fulfilling what the general statutes require with regard to funding.
How is it charged to you? Is it per trip? Is it per individual?
Per trip.
Like monthly, they send a monthly
They
statement.
do it weekly now.
Weekly.
I would suggest reaching out to the people and say things are tight. Can you combine trips or something like that? But it's a problem because I've had people complain when I'm around the senior centers.
What's the definition of providing the service?
We can do it in any number of ways. I mean, I think in theory we could call, as long as we had, for example, in theory, if we had Uber drivers who were had fulfilled all the requirements for providing this service, and we had them on the phone, we could call an Uber driver and say, take this guy to XYZ or location, or it can be through a contract like this, or we can provide the service ourselves with our vehicles and our drivers. So there's no one way it has to happen. That's a fair statement.
But my question is, if we cut 3% out of the program, can we provide the service without the 3%? Or is that service locked at some threshold that you have to be there?
The
I
funding,
just don't understand why
the
we can't
funding
make a
level.
3% program cut.
Well, this is one of those things where, in the past, the state has funded us for what it costs us, and our cost was something that was locally negotiated, and so the rate schedule isn't even the same among counties. It's whatever it cost
Yeah.
to provide the services previously, and now the state is saying you got whatever that was before, you're only going to get 97% of it. It's up to you to renegotiate with the people providing the service. Did I answer your question?
No, not really.
No, I'm sorry.
I mean, how many people are going to be affected? I asked that already, but if we haul one less person per month because of this 3% cut,
We can't do that. We're obligated to give that person a ride.
so there's a certain number of people that's fixed.
If they meet their,
There's a fixed number. We got to have that 3% to do this fixed requirement.
well, it's not fixed because the number, the people and the number of people changes all the time based on what their
Medicaid
situation is.
eligibility, yeah. If they don't have Medicaid, they do not get the service.
Yeah.
If
So we're not defining what the service is. Then I mean,
it's hard
we
to
could cut 3% and still provide the service.
How?
Because however many people you haul for the 3% cut, with what's left of the after the 3% cut, equals providing the service. Unless you tell me there's a fixed number of people or a fixed amount you've got to spend.
We have to, everybody who qualifies for the service, we have to provide it to them.
Okay.
And so it's not a fixed allocation per se, it's a per ride type of a formula. So is it monthly we submit for the funding from the state?
Since NC Tracks came into play, agencies got to where they know if they turn in their bills,
Yeah,
they'll get the money quicker.
yeah.
So they've been doing it weekly.
So what if we have, with the current funding level, with the 3% included, we have people we can't provide the service to?
No,
If
because
we have
it's
people
fully
that-
funded,
yeah.
so it doesn't. I mean, it's not a fixed dollar amount that we get every month. It's if somebody qualifies, then Wyvetti provides the service, and then they give us the details in terms of number of miles traveled times dollars per mile, for example, and that goes into the NC track system. And previously, the state would reimburse directly for 100% of that cost. Now they're only going to reimburse for 97% of that cost.
and the number of people goes up and down every month.
Yes. And the number of the trips that they require goes up and down every month.
Okay.
Well, I lived it because I had to haul my mom and dad to appointments. If I wasn't there, they would have to find a service to provide that.
I agree that the service is super important.
I got another, I'll throw this on the table. We need to get together with these churches and these retired people that are riding around having a good time, and they provide some service and volunteer work. Anyway, I'm sorry, don't get me started on that.
They done 3% on non-emergencies. Did they do the same for emergency calls? You know, that people call for ambulance emergency.
Haven't read that anywhere.
I think we'd have to probably
Yeah.
ask Brandon.
Yeah, I know they haven't cut, you know, we pay people, we do gas vouchers
Yeah.
too for this program. It has not affected that.
I think my assumption though was that there's a Medicaid level, right, that they're willing to pay for an ambulance trip.
That's what
My
I heard.
assumption was that number has dropped too, and I don't know if it's by 3% or some other number.
They just pay a certain amount, don't they?
Yeah.
Yeah.
And whoever provided the service just has to accept that.
And eat the rest of it.
Yeah.
If we go with the 3%, it's something that we got to watch closely because it could jump to 10% with
Yeah.
time.
Or you know, we'll be doing a tax increase to pay for this.
Or you might be
stuff,
hauling me around in a few years.
you know. We'll be doing a tax increase before long if we follow this precedent to do this. And there will be no sympathy for that, I can promise you. None.
Well, I know that Wavetti, that last month, that they voted to adopt a more business effective practice, whereas you just can't call up and you're going to be the only rider to take you somewhere to Winston and then to come back. And I also at least one business office has been closed because when you started looking at the times and everything and the actual people that were actually coming into a physical location, and I'll just say it, I'm not saying this is where the town is, but I'm just giving an example, that, we have, might be somewhere in Davie County, and that the current schedules didn't make sense because on certain days when they have like one person, well, when they would come back, the office is closed anyway. And so it's like anything else is with technology, is that, you can consolidate, into one or two offices and there won't be a disruption in service. But they're looking at volume and days and times. So hopefully maybe they can squeeze some efficiency out of it to where some of the months, if we do vote to do this, some of the months won't be as much that we would have to shift around.
Because of consolidated trips.
Right. I'm inclined to, I hate these unfunded mandates. I hate them. And it's something that we will have to look at, but if Stacy can find some money in some accounts that, seem to be, going a little bit better than, what the expectations were, whatever, or kind of efficiencies, and we can cover it until we can get into our next budget year. But I wouldn't ask you to sustain that unless, it was a permanent, if you can find money in an area to where you just, you can effectively know that, hey, I won't need that amount of money. But I would be willing to fund it that way just until the next year. And like what the manager is saying too is, I mean, let's look at the efficiency. If, you know, we can always look at alternatives. If we think we can do it a better way, then we do it a better way.
Well, I can do that too, I guess, but you know, there's a new sheriff in town up in DC, and he's gonna cut the federal government a lot over the next 3 or 4 years, I hope. And, 'cause it needs a lot of cutting. And so there's more beautiful bills coming behind this one, at least 3 or 4 more probably in the next couple of years. And so I think as we go through the budget, we gotta have a process for addressing this stuff and not funding it and raising taxes here locally. I'm gonna just start voting against all of it if I have to raise taxes to do it.
Well, I think that, you know, like
We all support that change in DC, us Republicans up here. So.
yeah, but we also got to get, I mean, the state doesn't have to follow their state statutes, I guess. We do. So I mean, we can sit here and argue all we want and we can whatever, but the bottom line is we've got to follow the state statutes. The state doesn't have to. So what, I mean, what do you want from me? You know?
I want to hear from
I mean-
Sonia.
We can add to that.
Wayne?
I mean,
We need to make the state follow their own statutes as much as we can.
Look at that.
I know, right?
I mean, I feel her and I see Jeff's one. I mean, just to the top, you know. But I mean, if she's got the fund, you can support it now. I mean, congratulations. But, you know, and then I see Rick's side of the story, you know. Who comes next month want more money? You know, where does it stop? But then, like Jeff said, your back's kind of up against the wall. You know, you got to provide the service. So, and I, you know, and I'm always going to look after the elderly people, you know, or the handicapped people that don't have the ability to go like I do. So, you know, but I hope you can find the money to support it. I really do.
Is there any way it's in the budget that's not been approved by the state?
That there's a, I don't know what to what degree this problem's addressed in the overall funding bill, but there is that bill, that separate bill that's in the General Assembly right now to address 600 million of the 700 and something million shortfall in Medicaid funding.
Find us 3% right now. I asked her to find us 3% for right
It's just,
now.
yeah, it's just, I mean, we put it, and it's a temporary thing, and just to bridge us to when we start planning for the next budget. And, you know, Jeff can look at the, you know, to see if we can, there's a better way, or maybe why Betty does narrow that gap. No, it's not $600 a month or whatever, but I mean, I agree. We can't continue this, but at the same time, we can't violate the general statute. I mean, so we can sit here and.
Why are you saying violating general statute?
Have we ever had a county fundraiser?
I guess, I mean, and I don't know how feasible it really is to think that somebody else is going to come and want to also provide the service, but
Probably not.
the other side of it is, unless there's competition, why Betty's not going to do it for us, right? So,
Yeah, that's the problem.
yeah.
Is this a thing that is bid on? There's no bids like on this, like to maybe the competition, like you say, would keep the cost down if they had to bid this.
We have done that.
And Wavetti's usually the cheapest.
We've had multiple carriers.
And we have
one
had multiple
time.
carriers,
The guy in Walnut Cove used to do a lot of it.
JD Cruz.
Lady Cruz,
Yeah.
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 There's a lot of people offer that station.
No,
I didn't think so. I see the white bed being Livermore.
Maybe Trump will get all these able-bodied young people off Medicaid that are sitting home not working and find some money there to take care of it.
They can drive people.
What?
They can drive people.
Drive the
Yeah.
other people.
And they can play video games while they're waiting on it.
Or the man that calls for an ambulance 8 times a month, that's on it, that don't need it.
Yeah. We'll move to action today or whatever.
Can, does this need to go to action?
If you will, yeah.
And the temporary is, the cutoff is at the next budget.
I mean, we'll
Approval
know
is
as we're
next.
preparing for, I mean, it's right around the corner.
Yeah, I know.
We'll be jumping in and
What's the term on our contract with Money Betty?
June 30th.
Okay, so we would make the change until then,
To win.
June
June
30th?
30th.
Yeah.
And you said this was how much more money, Stacy?
It'd be 10 to 12,000 for a year, so it
Year.
might be 9 this year. Just depends on how many folks.
You're gonna get it all out of DSS
Yes.
somewhere else. Okay.
Can I say one more thing about not Medicaid, just about food stamps? I just want to put it on your radar. Things are bad without an approved state budget. And November might be a very bad month for folks who receive food stamp benefits. Just want you to be aware of that. It's not looking good right now.
That's because of the government shutdown. I actually saw some things, in, not here, but in other big cities where they were saying starting November that they needed like to have security for grocery stores, that people were just going to go in and start stealing whatever they want and robbing people in the parking lot taking their groceries and stuff. And it could get that bad. I hope not.
It could easily get that bad. That's a big deal.
So,
Cut them things off.
yeah.
Thank you.
Thank you, Stacy.
Thanks, Stacy. Good seeing you.
Okay, Tommy, you're up.
This gonna be easy, Tommy.
Yes, sir.
It's gonna be easy on my part.
That's the hope.
This is on y'all now. The good news is,
Before you start, turn around and look at the room.
I did. That's why I sit up front.
I can't believe you're talking with nobody in here.
Me neither, sir. Me neither. We met with the advisory board, all 5 members. Had a discussion. We went through the ordinance, pretty much page for page. If I had any questions, I answered it. And they made one suggestion, and it was on page 20. The restoration of breeding kennels. They wanted me to add the line, by doing this restoration, you agree to permit Stokes County Animal Control to come inspect your breeding kennel at twice a year during normal business hours of Stokes County Animal Control Department. That was the only thing that they requested us to add. That's the only changes from the last time it was submitted.
You made one other change.
Oh yes, I made one change.
Was it
There was a 30-day it was the ownership of an animal when it showed up at your house. I had 30 days, and after talking to several other departments, said we went back to 7 days. It was at 5, and I said that was a little bit short, so we went back to 7 days as ownership. So that's the only 2 changes that's been made whatsoever.
And you made that change before the board looked at it.
Yes, yes.
I didn't follow that. What is that?
That was ownership. So if it shows up at your house and you feed it for 7 days, it becomes your animal. So you can sign owner surrender. If you call us, if you try to find the owner for 7 days and you ain't found it, then you call us. So now you can surrender it. We can go ahead and adopt it. Try to adopt it out instead of having to hold it for another 72 hours because you've already spent 7 days trying to find the owner. So now we can go ahead and try to adopt it out so it helps move the animals through the shelter quicker.
From 30 to 7.
Yes, we just moved it from 30. I had it in there at 30, but after talking to several people at the conference and stuff, they all said I would go back to 7 or 5. So I went with 7 on that.
I have one question.
Just make sure my grandson don't read this ordinance. Because he won't keep everything come 7 days.
But it was a good meeting with the advisory board. Everybody got along. It was actually the first meeting I felt like we accomplished something since I've been here with the advisory board. Needless to say, nobody showed up. It was just us, them 5 and me sitting there talking. We had some good conversations and some legit questions. And once legit questions, and once they were explained, it's like, yeah, no, don't see no problem with it. They voted unanimous for this ordinance that's presented by me and county manager to y'all to be adopted by y'all.
Rick's
Well,
got a
you-
question.
You're going to inspect them twice a year. Are those announced or unannounced?
Those are unannounced. What we do, and as I told them, the permit already asked. The permit already stated that. So the application, when you filled it out, already stated by filling out this application, you give us permission to be able to come to your property and inspect this twice a year. That was already done. It was in the it was in the ordinance now, so we just went ahead and put it back in this one. But as I explained to the board, it was already on the application and on the kennel permit that we used. So it's unannounced. What we usually do is we start that way. We get about 5 to 10 minutes out. We call and say, hey, we're coming to inspect your kennels. Because a lot of times they're not there or whatever. So we call and say, hey, we're coming to inspect your kennels. We're going to be there in 5 to 10 minutes. So that gives them, we know they're there. We pull in the driveway and we wait for them to get there. So they never, so we're there. And you can't do a lot in 5 to 10 minutes as far as cleaning it up, straightening it up. So.
I think it's very important that those stay that way, unannounced, because
Yes.
if you give them any lead time, they can do a whole lot in a short time.
Yep.
I've experienced that before.
Yeah. So we like I said, we usually, and this is
Hide everything.
an honest man's ordinance. This is one that, hey, yeah, I'm doing this. Here you go. I'm going to pay you the money. You know, we might find a few here and there that we can actually charge, but that's what I always call one honest man's ordinance. That, yeah, I'm going to follow the law. Here it is. I'm paying, and we got a couple that will do this, but the rest of them we'll just have to pop up as we find them and deal with them. But we need it in there. But other than that,
I agree with that.
everything else is pretty much straightforward. In the ordinance, they thought it was. They thought it was a good ordinance. They voted unanimous for it. So basically, I'm asking y'all to accept our opinions and move this forward to action and put it in as the new animal welfare and control.
Any other questions?
Now I'll make a motion, we move it to action.
Do I hear a second?
Second.
All in favor?
Aye.
Okay, Pine Hall Elementary School update. I know the school is not back in our hands, but I wanted the public to know that we're not sitting here twiddling our thumbs. I've personally had conversation with Duke Energy to see if they were interested, and I'd rather not name the other party that me and Jeff met with Friday. They take situations like this and turn it into senior citizen housing
Or other
or others.
affordable housing, yeah.
Yeah, with grants they can get. It was a very impressive meeting, but since the school board hasn't moved any yet, I don't feel I should mention their name or anything until it's back in our hands.
Yeah, they're a nonprofit, so, but this is right in their wheelhouse. They do projects like this. It's not always something like a school. It could be undeveloped property. It could be any number of type of situations, but they're in the business of kind of working with local governments to facilitate development of affordable housing.
And they have been to the site, and they would, with 11 acres, they would put other single dwellings on the site. So that's all I had was that, other than I still want the input of the community, that what they've come together, but
Yeah.
that will happen when the school board moves on what they're going to do.
I guess the other thing we talked about on Friday was, is there a consensus among you that maybe we should approach the school board with this opportunity and see if they might entertain it?
Does anybody know what was discussed at the school board meeting in regards to Pine Hall? Because I haven't had time to watch their meeting yet, but I'm pretty
You
sure
need
they
to.
discussed
It's
it.
very interesting.
I mean, did they talk about it then?
Oh yeah, they talked about it, and I still don't know heads or tails other than they showed
Yeah,
it.
and to be more clear, this isn't giving the property to some nonprofit for them to develop it. We'd still be required to sell the property in accordance with the general statutes requirements.
Nobody's gonna get rich.
Nobody, yeah. It was we discussed I guess we shouldn't go into too much into details with who's been involved with other projects and where in the past, but the folks that we talked to suggested that what we can do is, if the school board gives us the property, or if they want to handle what we're suggesting on their side, then they or we as a property owner could put deed restrictions on the property to say it can only be used for certain things. And then you put it on the market for sale, and so that kind of wickers it down a little bit.
They also mentioned they would put in a contract, they got so much time to make this happen, or they give it back to us.
Ownership revoked back.
To me, the meeting was almost too good to be true.
That almost like it would be a good thing for the community, for the county as a whole.
That's what we have done.
I think you need to send those people to talk to the school board since apparently they own it and we don't.
Well, if I had to vote today, it's theirs. But I'm just one.
With you.
That's two. That's three. I'm with you too.
That's what I'm saying.
Or,
Ain't nobody knocking the door down to buy a school.
No.
No.
well, they didn't want to sell it to us for $1, so
Would you like me to approach
let them.
Yeah,
let
let's
these people
Dr.
go
Rice
talk to
and
them.
let him know about this opportunity, and that he can take it from there?
yes, there you go.
So, I mean, when
Well-
at least as of the last meeting, at least the public meeting, I'll say that, is that, you know, they can't make their mind up. They still kind of want to control what we do with it. You know,
Just let them have it.
I agree.
I mean,
I agree.
I'm not going to take it and then them tell us what we can and can't do with it.
I agree 100%.
It's not on my Christmas list.
No, we got enough things to.
Yes, I agree.
We either take it or they take it, but no hybrids.
No.
I agree.
Okay. With
That
that
was
said, so Jeff will contact Dr. Rice. So I'm going to move on to Stokes County Nursing Home Community Advisory Committee appointments.
It's long. It's a long.
Mouthful.
So Beth Johnson from the Piedmont Triad Regional Council reached out to me a couple weeks ago about two residents of Stokes County, Jennifer Meter and Winona Sands, who had completed their 3 phases of training, and they're wanting to be appointed to the Nursing Home Community Advisory Committee. I, in the switch over from the agenda software, negated to put this on last week's agenda. It should have been. So I am asking, because this is something where they had to go through training, this is not something where, to my understanding, you can just jump into it. I do believe you have to go through this training, that we expedite the appointments and essentially just poll the board today. Attached was their applications for the board as well as their hours of training.
So there's 2 positions needed.
I bet there's more than 2, but yeah, there are room for both of these
Okay.
applicants. So we can move that to action if that suits the board, and then we can just poll the board.
Let's just move it to action.
Let's do that.
Okay.
I'm good, yeah.
Yeah.
With that said, let's go to action.
Let's go to action. First item on the action agenda is the non-emergent Medicaid transportation.
Make a motion that we empower our DSS director to move money within the social services budget to temporarily fund the shortage of the 3% difference in funding until June the 30th of 2026.
Do I hear a second?
Second.
All in favor?
Second item is the animal control and animal welfare ordinance.
Do we hear a motion to approve?
Motion to approve.
Second?
Second.
All in favor?
Aye.
And then for the Stokes County Nursing Home CAC appointments, you can poll. Names are Meter and Sands, so we can just go however we want to start. You would just say their names.
Start with Sonia.
Meter and Sands.
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 Okay. That takes us to closed session. Correct.
Yes.
We'll be moving into closed session for the following rationales. To consider the qualifications, competence, performance, character, fitness, conditions of the appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee pursuant to General Statute 143-318.11.6.
Do I hear a motion to adjourn?
Motion.
Second.
All in favor? Aye. Guys, that was a good meeting.
I'm telling you.